Gentlemen, imagine a single small spot on your body that would 60 seconds of focused attention can help restore circulation, ease build-up tension, and support performance that's faded since turning 50. Before you wave this off as fringe medicine, listen for a minute. This isn't mystical. It's a simple, practical technique rooted in long-standing traditional practices and increasingly supported by modern pelvic health science. Over the next few minutes, I'll describe where the spot is, how to find it, the safest way to massage it, which oils can assist, and why this brief practice can become a powerful, private part of your daily maintenance routine. No gadgets, no appointments, just a minute in privacy that can shift how your body responds. Let's be blunt about what changes after 50. Many men chalk declines in sensitivity, reduced spontaneous responses, and slower blood flow up to aging, then treat the symptoms when they need to. But underneath those surface complaints are mechanical and neurological changes you can influence. The pelvic floor muscles, the ones that support urination, ejaculation, and erection, often become paradoxically tight and weak. Think of a rubber band stretched for too long. It's taut but lacks snap. At the same time, blood vessels in the region grow less elastic, and nerves can be compressed under chronically tight muscles and poor posture. Years of sitting, stress, and reduced activity create what I call a localized traffic jam. Circulation clogs, nerves are pinched, and tissues stop communicating well. Because men rarely talk about this, many never learn about practical, non-invasive fixes. The healthcare community is taking this seriously. Pelvic floor training and targeted manual therapies are now used by physiotherapists and urologists as part of conservative treatment for pelvic dysfunction and sexual health concerns. Studies and reviews support pelvic floor rehabilitation, improving function for many men. The specific spot I want you to learn is the perineal area, the small patch of tissue between the scrotum and the anus. Traditional systems sometimes call it a high value point for male vitality, and anatomically, it's where blood vessels, sensory nerves, the root of the penis, and connective tissue converge. When you apply gentle, purposeful massage here, you influence blood flow, reduce local muscle tension, and can indirectly improve prostate circulation. Picture a clogged intersection where several main roads meet. A light touch in the middle can help redistribute traffic and get flow moving again. Finding the spot is straightforward. Sit on the edge of a chair or lie on your back with knees bent, feet flat. Use your index and middle fingers and feel gently in the center between the scrotum and the anus. You're looking for a slight indentation or softer tissue about halfway between those 2 points. It may be a little tender when you first press. That tenderness often tells you you're in the right zone. Take a breath and don't rush. If anything feels sharp or truly painful, stop and reassess. Now the technique, simple and repeatable. Warm a small amount of oil in your palms so it isn't cold on sensitive skin. Apply moderate pressure, about what you'd use to test ripeness on a tomato, and make small, consistent circles for 30 seconds one way, then 30 seconds the other. That 1-minute routine is all you need to start. Variations work too. Some men prefer a gentle up and down pulsing, others like a press-hold-release rhythm. Press for 5 seconds, release for 5 seconds. The important part is consistent, comfortable pressure, not brute force. This is not deep tissue work. It's a sustained, rhythmic stimulus that promotes circulation and eases tightness. If you feel sharp pain, lighten up. If you feel nothing at all, adjust pressure or check your position. It usually takes a few tries to hit the sweet spot. Using oil makes this easier and more effective. The oil reduces friction so you can maintain smooth, consistent motion. And some oils bring additional properties that support circulation and soothing. My top practical pick is castor oil. It's long been used traditionally for soft tissue circulation and has ricinoic acid, which appears to have anti-inflammatory and tissue-soothing effects in topical applications. Castor oil is used in various pelvic health folk remedies and topical therapies, though its clinical evidence is limited and it's not an FDA-approved treatment for sexual function. Use it warmed and sparingly. If you prefer a milder, more readily accepted option, virgin coconut oil is a good alternative. It's gentle, absorbs well, and has antibacterial properties that suit sensitive skin. Black seed oil, Nigella sativa, is another traditional option cited for vitality, though it's costlier and less widely studied for topical perineal use. If you mix essential oils, be cautious. Use them diluted in a carrier oil, no more than 3 to 4 drops per ounce, and avoid anything that causes burning or irritation. So what's happening physiologically when you do this? First, the massage creates a local pumping action that mechanically encourages stagnant venous blood to move out and fresh arterial blood to enter. That improved circulation brings oxygen and nutrients and removes metabolic waste. Second, the gentle pressure stimulates and decompresses local sensory nerves that can become dulled or irritated by chronic tension, potentially improving nerve signaling to erectile tissues. Third, by relaxing trigger points and tight bands in the pelvic floor, you restore more effective muscle function. Those muscles are essential to erection quality, orgasm control, and bladder function. Finally, the parasympathetic activation from a calm, intentional minute of breathing and touch lowers sympathetic stress hormones, which can otherwise impede sexual response. These mechanisms aligned with what pelvic floor clinicians and recent reviews describe about conservative treatment for male pelvic dysfunction. When should you do it? 2 times are especially useful: morning and bedtime. Morning sessions can ride the natural testosterone uptake and help circulation for the day ahead. Evening sessions support relaxation, nighttime erections, and restorative sleep. For beginners, start every other day for the first week so the tissues can adapt without irritation. After that, aim for daily practice of 1 to 2 minutes. Many men find that 1 minute every day is more effective than sporadic long sessions. If you plan intimacy, doing the massage 2 to 3 hours beforehand primes the system without overstimulating it. Some men like doing it earlier in the day to avoid distraction. Common mistakes and how to avoid them. Don't press aggressively. If you're sore the next day, you went too hard. Don't give up after a few tries. Benefits tend to be cumulative, and many men notice subtle improvements in 1 to 2 weeks, and more marked changes after a month of consistency. Avoid petroleum-based products or fragrance lotions that can irritate sensitive skin. Stick to natural carrier oils. Don't try to do this through clothing. Skin-to-skin contact is needed for effective tissue feedback and oil absorption. Finally, make sure your posture is comfortable. If you're straining an arm or cramping, you won't stick with it. Beyond improved erectile response, men report unexpected gains from consistent perineal care: better bladder control, fewer nug-tunnel bathroom trips, reduced chronic pelvic or lower back tension, and improved exercise comfort for cycling or running. Because the pelvic floor is part of your core, when it functions better, your overall stability and recovery can improve. These anecdotal benefits have clinical echoes. Pelvic floor rehabilitation has been associated with improved urinary and sexual outcomes in men across multiple studies and reviews. Pairing this massage with simple adjuncts increases its effectiveness. Do a short breathing cycle while you work. Inhale for 4 counts, hold for 4 counts, exhale for 4 counts. It helps activate the rest and digest nervous system. A warm compress for 5 minutes beforehand relaxes tissues and improves oil penetration. Contrast with a brief cold cloth afterwards can invigorate circulation for some men. Gentle hip flexor and inner thigh stretches before or after, such as a seated butterfly stretch, reduce pulling on the pelvic floor and amplify results. Hydration matters too. Adequate fluids support microcirculation and help clear metabolic byproducts released during massage. Make it a habit by linking the minute to something you already do, after your shower, before you brush your teeth, or as part of your bedtime ritual. Keep your oil in a visible, convenient spot so you'll remember. Track progress for the first month with simple notes: energy, erectile response, sleep quality, and bladder control on a 10-point scale. Seeing small wins is motivating and helps you stay consistent. A few practical safety notes. If you have a known pelvic infection, open sores, unexplained bleeding, or significant pelvic pain, stop and consult a clinician before continuing. If you're taking blood thinners or have circulatory disorders, check with your healthcare provider. This practice is a conservative, low-risk maintenance tool, not a replacement for medical evaluation when needed. Here is my challenge to you. Try 1 minute every day for 30 days. Use a simple warmed carrier oil, follow the gentle circular pattern, breathe deliberately, and keep a short log of what changes. Most men are surprised that, over time, they experience not only better sexual function, but a broader sense of well-being, less tension, better sleep, and more confidence. Maintenance beats remediation. Address the mechanics now so you don't have to chase problems later. This is not a promise of instant miracles. It's a practical, low-cost form of self-care that targets the anatomy and physiology involved in male pelvic function. Consider it routine maintenance, like changing the oil in a car, but for your body. If this information helped, share it with a friend who might benefit. Openness about men's pelvic health helps normalize care and gets more people the simple tools they need. If you try this, I'd love to hear your experience. Your story can encourage another man to take that first minute. Remember, 1 minute a day, thoughtful touch, and consistency. Your best years don't have to be behind you.